here's what I want to do. I want to tell a few stories. Some are good, some are bad. And then I want to talk about what if I had the tools that we have now to go back and redo some of those stories. So the first one, I'm at UCLA. I'm a child and adolescent psychiatrist, but I also see adults. And we start a program where there had been some suicides among UCLA medical students. And they asked me to start seeing that group of patients with the team I'm working with. And I get this medical student who's brilliant and has really, really bad depression. And I do the meds, and this great psychologist named Paula Stossel is the therapist, and we do kind of coordinated care, and we get him through med school. He goes on to do a residency in internal medicine at another organization, and Paul and I treated probably, I don't know, 200-300 patients together. She was one of my main therapists when I was doing med management for these young adults. And about 3 years after this patient went from my care to he started getting care in his residency, Paula came up to me and she said, "Did you hear?" And that's all she had to say. I knew he had committed suicide. And it just blew me away. She literally did not say another word. I went, ultimately, I called his family, and I went to the living room, and I talked with his mom and his stepdad. And I told him, hey, this guy was a bright guy. I took care of him for a few years. It ended about 3 years ago, and then he went on. And the mom asked me, she was kind of angry. I don't blame her. And she asked me, why didn't you do something to prevent it? If you knew, it was like I knew. Why didn't you do something to prevent it? And that kind of just has been going on and gone in my head. Fast forward, I had the opportunity, I was 25 years at UCLA and had the opportunity to lead the UCLA Health system. And there was this woman who came in. She happened to be a UCLA alumni, and it was very similar to, these land grant institutions. And she's a UCLA alumni. She's 65 years of age. She comes in. She has abdominal pain. We see her in the ER. We say, everything's fine. Well, we looked at it again. Not everything's fine. You need to have surgery. And it's like midnight. She's there with her husband. I don't know if anyone here is from LA, but they live in the valley. UCLA's on the west side. It's about, I don't know, a 5-mile drive, but it takes about an hour and a half. So we say that she's going to have surgery in the morning. And what we'd like is the husband to drive home and get some belongings and come back. So when he leaves, he actually takes her purse with him because she's staying in the hospital. And we then reread a scan. This is the third time on the lady. And we tell her, actually, everything's fine. You can go home. She goes, well, I have no way to get home. And we said, well, you don't qualify for a taxi voucher. So she had a sweater on, and she had some cash in her sweater. So she took a taxi at 3 a.m. back to the valley, but didn't get far enough. She actually stopped at an ATM and got then enough money to get the taxi to take her all the way home. When she got home, we called again. We read the scan for the 4th time. It was an emergent thing. She did need to have surgery, and she came in. So she came in for surgery, and we're UCLA. We did it really well. The surgery was a success, but we had reused a syringe by mistake, so we had to get a consent to test her for HIV. And it came back and it was negative. So if it was care, it was great. We got the surgery right, and we didn't give her an infection. If it was your grandmother, it was the worst thing you've ever heard in your life. I brought her in. She met with about 400 people together, and we talked about the case, about, what are we going to do? We were never ranked number 1 in U.S. News and World Report, but we were number 3 at that point. And I'm like, this is the 3rd best hospital in the country. And here's this UCLA alumni that we just took care of, right? So thrilled with that team that we went from 28th percentile to 99th percentile in patient satisfaction. So we really changed that culture. Then I had the opportunity to move to my amazing wife, went with me from Beverly Hills to rural Pennsylvania, where I had the opportunity to work at Geisinger, and I like to point out we went from Beverly Hills to Danville, where the 6th best restaurant on Yelp is Wendy's. But I thought this was a mistake in my mind, but what I thought I was going to learn at Geisinger, because it's an integrated delivery system, is the payment side, which I did. But I learned something that was far more important. Where at UCLA, I knew how I could care for patients. And I knew as I had these opportunities from a leadership standpoint, could I scale that care? And we did. We got a lot of individual patients phenomenal care. And then what I learned at Geisinger is what happens when you actually are in love with your community, right? This is a place where no one moves. They've literally lived in the same house for 9 generations. And they don't even know Geisinger's good care. It's just where they go. They call it the Geisinger. That's where I get my care. And if we have delays, they don't go, and it's only a couple hours to Philly, they don't go to Philly, they just wait. And because of that love in the community, Geisinger had this history of innovation. And the innovation wasn't because we wanted to be innovative, it was because these folks, about 3 million people that we cared for, couldn't afford insurance. So we started an insurance plan. These folks, a lot of them, had major food insecurity and type 2 diabetes, like Omar talked about. And so actually Andrea started the Fresh Food Pharmacy, which now serves millions of meals to type 2 diabetics and their families, and we saw it was 2.5 times better than metformin and dramatically decreased the cost of care. Back to some of the discussions around alignment. As the payer, it actually worked for us. We also created the largest whole exome sequencing with the return of results in the world, and it did lead to a lot of drug discovery for Regeneron, who kind of funded it for us. But it also meant that when this 16-year-old girl came in because she was dehydrated from soccer practice, and we did her genome, because we did it on everybody, we found she had 2 genes associated with fatal cardiac arrhythmias. And guess what? We took care of 30 patients in her extended family, and 15 of them had that. So we were able to intervene. It was an amazing experience at then thinking about scale. Now, because we had all the data, we were the largest Epic install ever at that point. We were the first Epic outpatient. We had the genomes, we had the claims data, we had the longitudinal record of the people, and they didn't leave. So think of it as like Iceland of America. All the data companies are coming out. So every 2 weeks, guys from Google in hoodies are showing up, and they have these great, great ideas. And then 2 weeks later, there were new hoodies and new ideas. And I said to the team, this last panel was fantastic. I wish I had it before I started my career here. But I said to the team, we're going to ban Google from campus because these folks don't listen to what we're saying. They're coming up with ideas that don't make sense. We need to move fast. I don't think we have shared alignment. We really have a lot of work to do. And then I got a call from Google. And Google said, we want you to come run Google Health. I said, oh my God, I just banned Google from campus. And this was an interesting conversation that took place over a period of time. I actually then went out to Palo Alto. I interviewed, and I had dinner with my brother and sister-in-law out there at the Palo Alto shopping center, the Stanford Shopping Center. And I called Andrea. I'm like, you can't believe how amazing this place is. They have Lululemon and Starbucks. Like, we had been so deprived of, like, you know, that. Anyways, went to Google. And it was an amazing experience. So this is my first experience going from the not-for-profit world to the for-profit world. And what I thought, this was actually part of my hesitancy in going, is these not-for-profit people aren't going to be like the for-profits are evil. That's what I thought. I get out there. These people are more mission-driven than any not-for-profit I've ever worked at. They're more focused on health equities and health disparities than anything we had ever done at UCLA or at Geisinger, and they're the smartest people I ever work with. So they put these teams together. It was a group from DeepMind, it was a group from Google Research, a group from Nest, the hardware company that was working on health. And there's about 100 projects. And I spent a half day on each one. And at the end of whatever, the few months, I get everyone together from all over the world. We had teams in Israel and the UK. And I go, wow, I've just gone over all these 100 projects that we're doing. They're phenomenal. I've never seen anything like this, but a little bit of feedback. About a third of them are illegal in healthcare. About a third of them would never, ever work in healthcare. And I think we have enough people to do 2 projects. So let's kill 98 of them and do 2 things. That is not googly. You don't do that at Google. It was probably the hardest leadership challenge that I've ever had. But we were successful. And one of the projects was, instead of building an app that has 1 billion users in healthcare, what if we made the platforms that Google already has, that has billions of users, better in healthcare? What if we made search and YouTube more authoritative? And then, I guess as luck has it, COVID happened. Google gets 20 billion search, this is when I was there, I don't know the numbers currently, but 20 billion searches a day. About 10% of them are healthcare, so 2 billion questions a day. COVID happened, and we went from 2 billion to about 18 billion were healthcare related, and the other 10%, we became 90% of the searches, were, I don't know, how to make sourdough bread or whatever we were doing. And our team, actually, just when I left, I think it's now 80 billion, it was 50 billion impressions of our YouTube information page. And talk about trust. Google's measures trust all the time. In every single country during COVID, the trust of Google went up. That was our team saying, let's partner with authoritative people and get good information out about how much do you have to wash your hands? What do you do with your vegetables? Where's a good place to get a COVID shot? Is it safe to go out? Are you supposed to wear masks? Think of the craziness that we were in. We were literally that information to the world. So I learned a lot about scale. It felt to me like it still was this Obtain thing. We had done the same thing at Google, but Google really wanted to stay focused on core search, Android, cloud, YouTube, and healthcare was sort of an experiment. So I got a call. I got recruited to 2 places at the same time, actually. One was called Oracle. I said, I'm not interested in that. And the other one was Cerner. And I knew Cerner was an electronic health record company. It happens currently to be the largest electronic health record company in the world. When we're done with the VA, we'll be, again, the largest in the United States. And probably 10 years from now, Dennis will be switching back to Cerner. We have more of grandma's blood sugar than anyone else. We literally are in the most used health app by any professional in the world. We literally get that last mile. There's so much we could do with it if we could just fix the EHR. So we moved again. We moved to Kansas City. 8 days after I got there, I got a letter. Oracle wants to buy us. The guy I was supposed to interview at Oracle, his name was Mike. He's now my boss. So Oracle buys us, and 2 things have happened. One is we fixed the EHR. We just talked about it last week. We launched our ambulatory EHR. It's spectacular. Not only does it make it easier for the clinician, it solves problems like communication from the ER to the floor upstairs. It solves problems about med reconciliation. It's spectacular. This ability of Oracle technology and the miracle of AI to come in has really, really changed the game. And this is stuff I didn't know about, the other thing that it brings is an end-to-end platform. So not just EHR, but back office, ERP, supply chain, human capital management, cloud hyperscaler, claims adjudication, life sciences that Oracle has always been in. And unlike Google, the guy I work for, Larry Ellison, has said we are now a healthcare company. So this is not an experiment. This is his legacy. He's been really successful in a lot of things. And this is what he's focused on. So it's really exciting. So if I take a breath right now and go back and say, what if I had AI? If I had AI, I believe that young medical student, that I kind of had the AI in my mind, we could have predicted what was going to happen and maybe thought about something different. I think with AI, I could take that woman who came in with the abdominal pain that we made so many mistakes with, and the AI could actually help with all of that throughput. I think the AI going back could allow us to scale at Geisinger that genomics program, which now should be actually multi-omics, right? It should be all that epigenetics and social determinants of health around food so that we really understand patients better. And the only way to do it, I think, is to do not only trust, but it's about partnership and being humble, that this is open and connected. And as John Beadle says, we're going to meet with health systems, we're going to understand what their problems are, and then together we're going to co-create that future. So that's why I'm excited about what we've talked about today. And I'm also really excited about the future. Thanks so much.